Healthcare initiatives raised during the recent budget debate were mostly well received by the public, but some lingering concerns remained over rising cost and manpower capacity. Over 100 participants took part in a dialogue session chaired by Health Minister Gan Kim Yong and Minister of State Amy Khor. Sarah Gross with more.
Better health insurance coverage and more subsidies. These are the focus of the Healthcare 2020 Master Plan. But while the government makes efforts to provide relief to those who need it, there are concerns this may lead to higher costs in the long term.
You're giving benefits on one side, but it might come back and then, haunt the citizens again through the insurance companies in terms of higher premiums.
The government may feel a little bit of a pinch, giving out more and more. But how far can you go by giving out more and more and more?
First, we change the way we do things to make sure that the cost maybe will still go up slower than what it would have been had we not done it. Secondly, we want to make sure that we encourage people to use the right level of medical care, so that you don't consume medical services that are unnecessary.
Mr. Gan added there are measures in place to help offset premium increases on MediShield, such as GST vouchers for the elderly. Manpower capacity was another concern raised by participants, made up mainly of healthcare workers and grassroots volunteers.
If the government wants to lower the number of foreigners who come in, so how do we then manage and calibrate it so that we have good nurses and other healthcare professionals who want to still come in and help to boost our healthcare systems.
We will increase the local intake here, but we will also try and get more of our Singaporeans who are studying overseas to come back. That in itself may still not be sufficient, especially in the short to medium term. So we'll still have to continue to attract some of the foreigners who are trained in recognized universities come to Singapore to provide services.
Now, in conjunction with this feedback exercise, which also conducted a telephone poll to assess Singaporeans' reactions to Budget 2012. And when it came to healthcare, the policy that was most well received was increasing subsidies in the intermediate and long-term care sector.